Okay. All right. So again, thank you. Thank you for being here. For those who don't know me, I'm Dr. Laura Robin, and I'm very excited because this is the launch of what I've been working really for the last 2 years on, and that is really trying to help to change the paradigm. And I'll be talking a little bit later about some of the projects I'm doing. So what I'm doing today is the first of a series of 3 weekend webinars that are dealing with fatigue. One of my favorite things to talk about is fatigue, and I'll talk about my own story in a little bit. But fatigue is just an overwhelming issue at this point, especially in our country. And I figured that would be a really good place to start. So basically, the way I see fatigue is I see fatigue as a kind of like that old myth about the frog in boiling water, because it's a myth. I don't know. I hope nobody's really tried it, but the whole thing is you put a frog into regular temperature water, room temperature water, and the frog doesn't really think anything about it. And then as time goes on, you heat up the water, the frog doesn't realize that the water's being heated. And I think that in a lot of ways, we're seeing that happen in the US. We're seeing that happen with climate change. We're seeing that happen with political things that are changing, and rules that are changing, laws that are changing. We also see that, I think, with the general health of America. And this is something that's just become more and more obvious to me over the past 35 years in my practice. So in the past couple of years, I have decided that I would be able to help the long-term issue and be part of the solution. So we are in an energy crisis right now. I was just recently listening to a talk by Jacob Teitelbaum, who wrote the original book, From Fatigue to Fantastic, way back in the early 90s. Up to 31% of adults complain of significant fatigue. The research that I was looking at went from like 15% to 30%, but it's pretty significant how much fatigue we are seeing in this world. So what's behind that? What's behind that is that our world has changed. We are a 24/7 world. We're globalized. We're urbanized. We have basically changed our diet. We've changed our levels of activity. We have just taken on so many incredible risk factors. So we'll talk about some of that. The question is, one of the things is your lifestyle killing you. So we look at the food we eat, our activity levels. If we were to compare ourselves now to where maybe we were even 100 years ago, but even thinking about where we might have been 10,000 years ago, how much stuff has changed, how our support systems have changed. And now we've gone from a tribal kind of a way of life to we're all living in our separate houses, thousands of miles away, in many cases, from our families. And when somebody has a baby, they have to support that baby all by themselves, and they don't have the extended family and the whole community to help. Levels of toxins, the amount of challenge that we put our bodies through with just the toxins that we come in contact with, you name it. So we'll be talking about some of that stuff. When somebody comes in complaining of fatigue, there's a certain protocol that we all go through to try and figure out basically what's happening. And there's some basic labs that we look at to see if somebody might be fatigued because of anemia or leukemia, some terrible thing going on in their blood. Maybe they're on a medication that might be causing fatigue, like a beta blocker or something like that. Also looking at, of course, alcohol, drug use. Is there some sort of underlying illness? Because many illnesses can cause fatigue. Might there be a basic vitamin deficiency? The better conventional doctors look at B12 and now vitamin D. And also they will look at thyroid. Often there are 2 tests that they'll do for thyroid, a TSH and maybe a T4. And because thyroid is one of the major reasons for fatigue. And then also asking patients how much sleep they're getting, because it's known that a lot of people are not getting enough sleep or not getting a good enough quality of sleep. And then also looking at mood, because depression can really look like fatigue. So as you see, the pie chart is half full and half empty, because what we're going to be talking about is really in this next time, and I'm going to try and keep this to under an hour. What we're going to be talking about in the next time is this whole right side of the pie chart. So I want to just tell a little bit about my story and why I am so interested in talking about fatigue. Fatigue is a very personal thing for me. I was never, even as a child, a high energy kid. I felt my energy was pretty average. It wasn't until really my 40s that I actually realized that I was suffering. I was really struggling with fatigue. I had a wonderful childhood. I don't have any of the ACEs, the childhood traumas. I had a mother who was a fantastic mother, and I had a father who was a fantastic father. In retrospect, I think what I was trying to do when I grew up was I was trying to emulate both of them. So what I realized in retrospect is I was trying to be everything that my father was, a physician and working full time and having a career, and I was also trying to be what my mother was, which was a very present, very loving full-time mom. But over time, that really started to catch up with me. And in my 40s, I started understanding that that was a part of my fatigue. Then I started discovering other things. I discovered a number of different things over the last years. I discovered I had big exposures to toxins. I had hormonal irregularities. I discovered several things, and I'll just talk about them along the way. Major sleep issues and thyroid issues and that kind of thing. And as I worked slowly, one by one, with each of these issues, my energy has gotten better and better and better. And I'm happy to say that I'm in a good place. Another thing that I found out about are some genetic components. So we'll talk about all of that. Energy from a systems perspective. When we look at energy, it's the piece of us that really makes us go. And from a functional medicine perspective, we look at not only individual body parts or individual diseases, we look at the systems of the body. We look at the body from a systems perspective. So when we're looking at what makes energy in the body and what can cause a problem with the energy, we look at the big things that we really look at. And these are the things that kind of take up the second half of that earlier pie chart that I showed. We look at metabolism and sleep and hormone and balance and neurologic balance. We look at inflammation, because inflammation can have a lot to do with our energy levels. We look at what's going on with our nutrition and what's going on in our gut. And one of the biggest things we look at is those little mitochondria that are in each of our cells, basically the powerhouses of our whole body. We're going to be talking about in this first webinar of this series of 3 are 4 major reasons, 4 major things that contribute to energy in the body and to energy loss. So we're going to spend a little bit of time on the mitochondria. We're going to talk about metabolism in general and how that can affect energy. We're going to talk a little bit deeper about sleep. And then we're going to talk also about nutrient status and some things that can affect that. So mitochondria, what are they? So this goes back to high school biology or biochemistry, for those of you who took that in college, or some of the things that we learned in medical school. Energy, what it's actually coming down to, and I just listened to a wonderful talk led by Dr. Jeff Bland, who is the founder of functional medicine. Just listened to a wonderful lecture on fatigue and the mitochondria. And what we're finding is whether it's long COVID or chronic fatigue syndrome or fibromyalgia or just even generalized fatigue that has where an underlying cause hasn't been see that it all goes back to the mitochondria, and the mitochondria is very much involved. So the mitochondria are these tiny little powerhouses of the cell, and this is kind of what they look like, but much more complicated than that. So the mitochondria originally felt to be an independent single-celled organism that somehow found its way into more complex organisms, which then eventually evolved to be organisms like us, like humans. So we'll talk about humans for now. But so they have their own DNA and their own RNA, and they have their own way of being and their own life cycle. And they do a number of things for the cell. We know of them as being the powerhouses of the cell, but also they have a lot of other functions within each of our cells. So when we see mitochondria, and I'm just going to move forward to this little next slide, because it shows a picture of a cell, and it shows these little green things are the mitochondria, and it shows maybe 5 or 6 of them. But the reality is that mitochondria, there are in every cell somewhere between 500 and 1,500 of these mitochondria in every single cell in our bodies. They make up more than half of the cell volume, and in some cases, much more than half. They're super, super important to the health of the cell. And so they make energy out of matter, but they're also responsible for lots of parts of the cell function. The health of the cell and the usefulness of the cell, and even the survival of the cell. Because if the mitochondria are not healthy, then they can start a process called apoptosis, which is basically a suicide of a cell. So you want happy, healthy mitochondria because you want your cells to survive. The mitochondria require multiple nutrients, not only to be able to make ATP or energy out of matter, or the basic level is sugar into energy. There are many nutrients that are required for that particular process. And then there are also nutrients that are required for the health of the mitochondria, because number one, just general reproduction of the mitochondria takes multiple nutrients, but also the mitochondria are very sensitive to damage by toxins and by infection and other inflammatory processes. And the DNA of the mitochondria can get damaged. And then as the mitochondria reproduce, just like cells reproduce, the mutations in the mitochondria can go on to affect its progeny and then the overall health of the cell and cell groups around it. So signs of mitochondrial dysfunction include things like one of the biggies is brain fog and cognition issues. Are the biggest concentrations of mitochondria are found in the brain. Think of areas that need a lot of energy, right? So the brain and skeletal muscle, cardiac muscle. So when our mitochondria are not working properly, or they're not getting what they need to be able to work properly, we see things like brain fog or cognitive issues, muscle weakness, lesser heart health, which can result in things like postural hypotension, which actually has many causes. But when we're not seeing enough energy going to the skeletal muscle and the heart muscle, we can have poor recovery from exercise. We can have fatigue that's not relieved by regular sleep. And it is really felt, the functional medicine perspective is that these big issues like heart disease and stroke and degenerative issues like Alzheimer's or Parkinson's are at their very base related to dysfunction of the mitochondria. So mitochondria health is affected by, as I said, it can be affected by nutrient deficiencies and inflammation, particularly cytokines, which are inflammatory substances, and also toxins and fluctuations in blood sugar, and also by infection. So the next thing that we look at when we look at fatigue is we want to look at the metabolic pathways in the body, because metabolism also can, in a huge way, affect energy levels in our bodies. So I just put this little slide up here to show you how complicated we are. And this is only like a tiny piece of it, because if you were to take, like up in the upper left-hand corner, you were to take the Krebs cycle and you were to blow that up, it is such a complicated thing. And glycolysis, such a complicated thing. Each one of these pathways is so complicated. And then this is only a small number of pathways that we are actually really taking place in our bodies. So we are super, super, super complex beings, which is awesome and really, really cool. And there are a lot of places where things can go off. The other thing to know is that and I'll talk a little bit about this later on, is that we're complex, and also everything that goes on in our bodies is interconnected. Everything in our bodies is interrelated. And that's one of the coolest, it's one of the things that's so most interesting to me about our bodies, is that everything affects everything else. Right now, what has happened with Western medicine is that we've broken it up into organs or organ systems, and we have specialists for each organ system, and we have people who make up protocols for evaluating and treating each organ system. It is lots of pillars, and these pillars don't actually connect, and they don't talk to each other. And a lot of us have had those experiences when we go to maybe a cardiologist who may not know what the pulmonologist is thinking, or that they may not know what the dermatologist is thinking, and then nobody knows what the neurologist is thinking. And what I'm hoping is that the paradigm of the future is going to be more of looking at the body as a really complex and interconnected being, where everything really is interrelated, and we are really paying attention to that. So I am breaking things down piece by piece here, but just know that everything, and by the end of this talk, you'll kind of see that everything affects everything else. So I'm going to talk a little bit about metabolism in the sense of sugar, insulin, energy, and fat tissue. Diabetes can cause fatigue, and that's about as deep as people know, and also really as deep as a lot of doctors will go with it. But how it affects energy production is it actually slows down the work of the mitochondria, and it also causes release of some factors of inflammatory factors and other factors like cytochrome C that actually can do damage and be that suicidal aspect of what the mitochondria can do to the cell. High blood sugar also can cause dehydration, and when we are in a level of underhydration, it also can affect our energy production and how the energy can get moved around our bodies. When we have low blood sugar, some people go between high and low, but when we have low blood sugar, it is more direct. When we have low sugar, our mitochondria, they don't have the basic building blocks to be able to make energy. So then we get drowsy, or we get hangry, or we get or we can lose consciousness or die. An interesting thing also is obesity is a common cause of fatigue, and we wonder why. There are several reasons. One is, sheer body weight and having to move that around, but also adipose tissue or fat tissue secretes lots of inflammatory factors, and those inflammatory factors again have a negative impact on the mitochondria. Do you see how it's all kind of coming back to the mitochondria? A lot of it just comes back to the mitochondria. The other thing is, when we have sugar issues, the eating more sugar, or even just generally having an elevated blood sugar, changes the balance of the bacteria and the whole microbiome in our gut from a more balanced state to actually the less beneficial bacteria, or maybe even harmful bacteria and yeast and other organisms taking hold and causing not only dysbiosis, not only gut issues, irritable bowel and other gut issues, but it also affects, because it causes more inflammation in the body and because of the secretions of the non-beneficial organisms, we can get changes and damage to the mitochondria directly from that, and also getting more reactive oxygen species, which is kind of a piece of how our metabolism can actually become more toxic. And when we talk about oxidation and antioxidants, it causes an oxidation process. So blood sugar, we have this roller coaster that goes on with insulin and food. And basically the green line is where we all would want to be, but the red line is where many of us actually are, particularly if we're eating a pretty standard American diet. But what happens is that when we eat particularly carbohydrates, sugar in a much more significant way, our blood sugar level goes up. And when our blood sugar level goes up, it signals the pancreas to release insulin. And what insulin does is, its job is to take the sugar out of the bloodstream and bring it into the cells. So when we have a big bolus of carbohydrates or sugar, our sugar level goes up, insulin level goes up, and then it causes the blood sugar to then drop. So the higher the blood sugar rise, the lower the drop is going to be. So if we're eating a lot of carbohydrates and sugar, and we're eating a lot of things that are really elevating our blood sugar, we're going to have this red line going on. We're going to have these fluctuations. And when we have these fluctuations, I already talked about what happens when the sugar levels are at their highest or the sugar levels are at their lowest. It really wreaks havoc on our energy systems. So also over time, this up and down and up and down and up and down creates an insulin resistance, which then can lead to diabetes. Then we have a chronic issue that's causing lots of problems with our energy on a long-term basis. So measuring blood sugar health, is the standard of care killing us? So this is the question, because this is an interesting story. I had to retake my boards about 3 or 4 years ago. I had to listen to a bunch of review lectures, because the review lectures were being given by the family practice organization that was giving me my board testing. What they were talking about is, they were talking about the fact that the only thing we need to look at is, we need to look at a fasting blood sugar. And if the fasting blood sugar is over 126, then we want to get a hemoglobin A1C to check for diabetes. Well, the truth of the fact is, from a functional medicine perspective, that if the fasting blood sugar is 126, by definition, we already have diabetes. And hemoglobin A1C is going to just confirm that. But the reality also is that the process that brought us to that place has been going on probably for a good 20 years. There are markers that can really help us to know that we're heading in that direction. So these are the 3 markers that are a really good idea to get on every single patient. We're seeing abnormalities in kids, and 8-year-olds and 12-year-olds, and definitely in people in their 20s. So it's really, really important, because of the standard American diet. We're seeing metabolism changing so rapidly, generation to generation, that if we don't really start catching it, we're going to have just an enormous problem in about 30 years. Diabetes has already probably, I think, tripled in the last 30 years. It's just going to keep, it's really epidemic. But anyway, these 3 markers, fasting blood sugar, hemoglobin A1C, and a fasting insulin, all 3 of them cost under about $25 to get if you were to pay a cash price for them. They're, of course, more if you go through insurance. But They are so important. And the fact that we're not doing them on a regular basis with everybody, I think we're going to be paying the piper in a few years, or we may already be. So how to regulate blood sugar, making sure, concentrating on keeping glycemic load and glycemic index low. This is a whole other conversation, and maybe a future talk. But removing the simple carbs like white sugar and white flour, eating plenty of vegetables, getting plenty of fiber, adequately hydrating, and then some helpful supplements to help to regulate blood sugar, berberine, chromium, and gymnema, which is an Ayurvedic herb. So food can also cause fatigue. When food causes fatigue, it can be lots of different things. And we know that alcohol can cause fatigue. That's pretty clear. And then there are lots of other things. We know that, our Thanksgiving turkey, contains tryptophan. There are a number of other foods that contain tryptophan. There are also a number of other foods like kiwis, for example, that contain melatonin that can also, put us to sleep a little bit. It's easy to Google foods containing melatonin or tryptophan, and if you've got somebody who's fighting fatigue, that's one of the things that they can pay attention to. Also, undernutritious foods. About 50% of the standard American diet is completely empty calories. Completely, we need nutrients to support our bodies and to thrive. And with all of the toxins and inflammation, the toxins in our environment, and all the challenges and stress and all of the inflammation in our bodies, we need more nutrients than ever to so that our bodies can be working with all of this. And then there are food additives and preservatives and dyes. A lot of people don't know that they have sensitivities to these things, and it's only by removing them temporarily and then adding them back and checking to see that we would even know that they might be affecting our energies. But you probably do know some people who say, when I eat blah, 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 when I eat something with blah, 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 and it's going to make me really tired. Food sensitivities and intolerances are a biggie also when we're talking about fatigue. So I'll talk about that in a minute. So food-related fatigue, sugar and carb-related fatigue, alcohol, additives, preservatives, dyes, toxins, and then food allergies, sensitivities, and intolerances. We also want to pay attention to, as I was saying, the nutrients that we're getting. Macronutrients are like, protein, fat, carbohydrates, those kinds of things. Micronutrients are the actual tiny little molecules, the vitamins, minerals, the molecules that help our bodies do what they need to do. What I want to say about that, and I don't have time to actually get into that's another actual talk, but the importance of the micronutrients and getting all of the right substances for our bodies to be able to do what they need to do. I will review a little bit later on. Also, when we look at fatigue, we want to look at genetic predispositions, because there are a lot of them, actually. Somebody did a study a few years ago that looked at people with chronic fatigue syndrome, and they did genetic testing on all of them, and they found 199 mutations, or they're called single nuclear polymorphism. They're differences. The mutation is kind of a hard word, but it's not really a mutation. It's a difference in the genes that control various functions in the body. So this study found 199 different SNPs that are specifically related to chronic fatigue, and that are found in people found more prominently in people who have chronic fatigue. There was a study in the UK, that just said that people who are prone to diabetes, who have the genetic risk factors for diabetes, are also prone to tiredness and fatigue. So talking a little more about the relationships between, more specific relationships between the SNPs and fatigue, is, since this is kind of an overview discussion, I'm really going to just name things, and these will all be potential topics for future discussion. But a few of the SNPs that are really important to pay attention to, one of the biggest ones is the MTHFR, which is methylene tetrahydrofolate transferase. And difference in the genetics there can really make up to a 60% difference in how we actually methylate in our bodies. And methylation is a process, one of those processes of metabolism that is super important, not only in making neurotransmitters that support our happy chemicals and our brain chemicals, but also in making B vitamins, making them active in our bodies. So this was another thing I found out for myself as I'm kind of I was just thinking about this morning, is how over the last 20 years, I was just peeling off the layers of fatigue for myself. And at first it was, I was overdoing it. And then I uncovered this MTHFR. Then I uncovered a few things after that. So anyway, MTHFR is very important. COMT is another one. And then there are just specific genes that are responsible for creation of cytokines, which are inflammatory factors. And some people have genes that make them make more inflammation. So really nice to check your SNPs. The way to do that is by doing a 23andMe or similar study. And then there are multiple programs and some of them are free, some of them cost a little bit, but give you a really good information. But you can just feed your raw data into a program where they can give you just a whole outline, a whole download of what of whether you have SNPs that might be contributing to your fatigue. So sleep is more complicated than just, we would ask patients, how many hours do you sleep? Then we started asking them, is it more difficult for you to get to sleep or stay? And then the sleep studies came along. But the reality is that, okay, the sleep studies will tell us how much REM sleep we're getting or how much actual sleep we're getting. But what they're not going to look at is the deeper, more root cause levels of what's actually going on there and what is actually causing sleep issues. So there are multiple things that can cause sleep issues. Again, blood sugar, alcohol, and some of these things we're going to talk about in the next couple of weekend webinars when we talk more about hormones and talk more about some of the other issues. But cortisol, which comes from our adrenal gland, cortisol levels can have a huge impact on sleep. And stress impacts cortisol levels. Thyroid, about 50% of thyroid issues that are out there are under or undiagnosed. There are a lot of people walking around with thyroid issues. They don't know about that. Some people will take supplements, like the more activating supplements like ginseng or B vitamins, before they go to bed, and this can interrupt sleep. Levels of melatonin. As we get older, melatonin generally decreases. Melatonin is made by a gland, which is in our head. Melatonin is a big overseer of all the other hormones in our bodies. Another fascinating thing that we're going to be talking about in the part 2 next month, but super important to sleep. And many of us are deficient. Progesterone is another piece that we'll be talking about, but that's another hormone that can really affect sleep. And then some of us are more sensitive to just the general energies of the world. And I happen to be one of those people as well. And what I've learned for myself is that I have to take a shower before I go to bed and just kind of wash off the energies of the day. There is a subset of the population that just tends to be a little bit more of a magnet for all of the crazy energies that are out there. So it's just another thing to be aware of. Chronic fatigue syndrome is not improved by rest. It has to have been present for about 6 months. It also, very common with chronic fatigue is post-exertional malaise, problems with thinking and concentrating, or brain fog and other issues, generalized pain or intermittent pain, dizziness or vertigo. And just to know that there's no specific testing available. So there's a lot of overlap between, I'm tired, versus I have chronic fatigue syndrome. But there are some specific pieces of chronic fatigue syndrome that are a little bit different, like, sleep doesn't make it better, the malaise after, or muscle pain after exertion, that kind of thing. We're learning so much about chronic fatigue, and we also now that we've been through the COVID pandemic, and we're seeing so much long COVID, and we look back at the Gulf War and Gulf War syndrome, the veterans who are coming back from the Gulf War having symptoms very similar to chronic fatigue and syndrome and fibromyalgia. It's really thought that all of these things are very, very closely related. And if you start breaking down the chronic fatigue, one of the biggest players is the mitochondria, of course, and inflammation, very often associated with either toxic exposure or exposure to a virus, and the long-term effects after exposure to a virus. So let's talk a little bit about solution. I can't believe our hour is going so quickly, but let's talk about solutions. So the basic labs that are used to evaluate fatigue, doctors will generally get a blood count, a CBC, a chemistry panel, and a TSH, or maybe even a T4, and then they may or may not do a morning cortisol level. And these are all important labs. They're very, very important labs because they really identify the big issues that might be happening. Remember when at the beginning of the talk I showed you the pie chart? It's really that half of the pie chart that these will illuminate. The problem is these do not help to illuminate anything on the other half of the chart, and that's of what I want to go into right now. One thing we want to get is a SED rate, which can rule in or out other types of autoimmune, other issues like autoimmune issues. We need to, and we'll talk about this in the next weekend webinar talk, is how under-tested, how underdiagnosed and under-tested our thyroids are, and that there are 5 or 6 different things that can be going on with the thyroid and with the whole hypothalamic pituitary axis that can really mess up how much circulating thyroid hormone we have and how well it can work in our bodies. So this is a whole discussion on its own, but just know that most thyroid is underdiagnosed, undertreated, and thyroid is an enormous player in energy levels. DHEA is a hormone that's made by the adrenal glands, that and a couple of other places, but it's also very much responsible for energy. Vitamins like B12 and D, very, very important to look at. And more doctors are now looking at vitamin D, but it's still actually outside of the norm to be looking at vitamin D. And vitamin D is a super important thing to look at. Now, if you get it done and you're paying insurance, it's going to cost, it can cost up to $1,000 to get a vitamin D level if you're paying through your insurance. If you get, I'm associated with a lab where we pay cash prices, and I can get it for $40. So just know that you can get it for not a lot of money, especially if you pay cash. And if you do go online, there are ways of being able to get these levels done at less expensive if you're paying cash prices. Not only looking at anemia from an iron and TIBC place, but also looking at ferritin levels. Ferritin is a measure of the actual storage of iron in the body. The iron and TBIC is kind of what's circulating around in the blood. Ferritin is very, very important in looking when we're looking at fatigue. The other thing about the iron and TIBC is that the levels that are considered normal from a conventional standpoint may not be optimal for people who have fatigue. Another thing about this, when we talk about hormones, is total and free testosterone. Levels of testosterone, both in men and women, can have a huge impact on energy levels. Cortisol and complete adrenal health, the rhythm of the cortisol in the body throughout the day also has an enormous effect on energy and fatigue. And these are, again, all things we're going to be talking about next time. And then, of course, the DNA testing, which is also a lot less expensive if you go with one of the companies that do the whole comprehensive test. So barriers to getting the deeper labs is that labs bill insurance, the cost of the lab, they bump up the price 10 or 20 times, and it can be very prohibitive to be able to get any of the labs that outside of the considered standard of care in the conventional world, because if the lab charges the insurance 10 to 20 times what they would cash if it was a cash price, and then the insurance refuses to pay for it, the patient is responsible. And that's a really big barrier to being able to get the deeper lab. So just know that, and I'll talk about this in the third section when we're really wrapping up the solutions, is that there are a number of labs, and you can go on my website, and also I have one of these labs on there you can take a look at, but there are a number of labs now that will just do cash prices, and the patients can go online and get them without a prescription, some of them, and then physicians can offer them in their offices. And another barrier is that clinicians just aren't trained to some of these deeper ideas, and even are not trained to look at it, because it's basically the insurance companies and the folks who have the money are the ones who have a say in what goes into medical training, and even the continuing education of clinicians. So a lot of the information is just not getting out there. Another issue is what's normal versus what's optimal for a patient, and that is another thing that when we're looking at things from a deeper level that we're really paying attention to. So basically, solutions in this first part regarding the mitochondria, metabolism, sleep, genetics, and nutrients is we want to normalize blood sugar as much as possible and reduce fluctuations. We want to evaluate for food sensitivities and intolerances. We want to get the basic micronutrients like multivitamin, vitamin D, omega-3s, a probiotic, magnesium, and then there's additional mitochondrial support. And I think I have a quick slide on that. We want to also consider genetic testing for SNPs. We want to make sure we're hydrated and make sure that we're sleeping well, and really deep sleeping well, and then moving our bodies. Classically, people with chronic fatigue and fibromyalgia have a poor response to exercise, but even just starting slow and walking out to the mailbox or doing a little dancing for 15 minutes or something like that just getting the body moving gets everything moving and can make an enormous change in sleep and energy. So mitochondrial support includes multivitamins, vitamin B complex, CoQ10, NAC, glutathione, acetyl L-carnitine, alpha lipoic acid, a good combination of phosphoglycolipids and fructooligosaccharides, D-ribose, and plenty of water, and also salt, because a lot of people whose adrenals are pooped out and require a little bit more salt. Doing a food allergy elimination protocol is always one of the first things that I like to do with people, because foods can so often be an unknown reason for fatigue. And I have just seen so many people lose their fatigue and lose their brain fog once they've actually gone through a food allergy elimination. So I recommend a food allergy elimination down to a paleo autoimmune protocol, and really, so removing things like alcohol, sugar, caffeine, gluten, dairy, soy, grains, and a few other things, and just removing everything for about 3 weeks and just giving the body a rest. If you can do a little gut repair at the same time, that's even better. And then adding the foods back one at a time, and then you'll really see what people are reactive to. I know of a number of people who just get super tired when they eat sugar, or they get really tired when they have something that has a preservative or an additive like MSG in it, or maybe even a specific food that actually can make them really tired. So we want to address the sleep hygiene. There's so much out there about that, that you can just access online. Don't be afraid of melatonin. You can start slow with a milligram, and even going up to 10 milligrams is super safe. If a person has too much melatonin on board, they're going to be tired in the morning. They're going to feel hungover, and they're going to have a little headache. So they'll just know that they've taken too much. For people who have trouble getting to sleep, immediate release melatonin is better. For people who have trouble staying asleep, sustained release is better. So very often a combination of both is good. And then something that's very well absorbed, there are micronized melatonin and liposomal melatonin are a couple of things that work really nicely. Nutraceuticals like magnesium can really help to cool down the muscles, and it's really good to help with relaxation of the body as a whole. But different things like 5-HTP, lavender, passion flower, valerian, and then also medications. And the recommendations from folks who are specializing in chronic fatigue is that if you have to use medications for sleep, use small amounts and use maybe a couple or even 2, 3 at a time combined, so that you're not just giving huge doses of one thing. You're actually just hitting it from very slowly from different levels. And it's the same thing with the nutraceuticals, because sometimes just a combination of things will hit the issues from different sides. And then we'll talk about progesterone next time. So just really briefly, I wanted to just talk about a little bit about how I'm looking at this and where the digging deeper comes from. You've probably heard all of these different kind of types of medicine and healthcare: functional, integrative, personalized, lifestyle, holistic, root cause. And essentially, they're all really similar. There are differences among them, in some places semantic. All of them really emphasize going deeper than what is happening right now on a conventional level, and really looking for the root causes, because the conventional level can diagnose. It can say you have a sleep disorder, you're not getting REM sleep, you let's see, you are grossly hypothyroid, your thyroid is shut down or something along those lines. But it's not going to get to actually the root causes of what's going on and why. And it's only by getting to those root causes, like what is going on in the cells, what's going on at the molecular level, that is actually going to help people to actually start turning things around and getting their health back. Functional medicine, everything in the body is interconnected, and disease dis-ease precedes disease, and it's an evidence of imbalance, blockage, or impairment in natural functioning. And functional medicine determines how and why illness occurs and restores health by addressing the root causes of disease for each individual. And this can go for any of those names that I talked about, but this is just coming from the functional medicine people. So, and for those of you who are osteopaths, you'll recognize this gentleman who is Andrew Taylor Still, who was the founder of osteopathy. And I gave a talk actually at the last American Osteopathic Association conference last year about how similar functional medicine is to the tenets of osteopathic medicine, because it's focusing on the whole patient and patterns and connections, and focused on finding the cause that's leading to imbalances and helping to create balance in the body. So what I've done, and I'm just going to summarize, during the pandemic, had an aha moment, and I decided that I was going to that what I really want to do for this last part of my career is to be a part of the solution, to help other clinicians to elevate their practices through the use of root cause medicine. And there are a lot of gold standard educational institutions out there, not a lot, but a few, like the Institute for Functional Medicine and A4M and a few others. And these are really wonderful ways to learn the actual basic sciences. And as you've seen in this 1 hour talk, there's a lot to know, and every single point that I made can turn into an entire, lecture. So I found that the functional medicine training I did through IFM was fantastic. And it was like a fire hose in my face 4 days at a time, but over a few years, because I had to take a bunch of different segments of the course. And what I found, what a lot of people find, what a lot of doctors and other clinicians find when they go through these trainings is they have so much knowledge, but on the ground, where do they start? Their first patient comes in the next day, Monday morning, with fatigue or with brain fog. Where do they start? What do they start with? And where I am hoping to help is by mentoring clinicians to be able to use functional medicine in their practice, like what are the pearls? Where do I start? What labs do I do? How do I order them? What are the important supplements? How do I evaluate supplements to see if they're worthwhile, or whether they have things that aren't good for my patient in them? How do I do things on a budget? If my patient's on a budget or I'm on a budget, how do I actually implement, and what are the practice management elements that I can introduce into my practice to really help my patients? So one of the things that I've done is that I've narrowed functional or root cause medicine down to 12 factors, 12 major system related factors in that can affect our bodies, and these are the 12 keys that I base a lot of my training on. And so modifying the effects of genetic and familial predispositions, optimizing key nutrients and using food as medicine, recognizing gut health as key to the health of the body, minimalizing the effects of food allergies, sensitivities, and intolerances and their roles in health and illness, reducing toxic load and minimizing toxic exposure and enhancing detox pathways, optimizing sugar, insulin, and lipid metabolism, boosting immunity and minimizing inflammation, optimizing mitochondrial health, which we spent a little bit of time on, optimizing adrenal, thyroid, sex hormone, and all hormone balance, minimizing the effects of stress on health and optimizing sleep, improving lifestyle factors and enhancing emotional and spiritual health, and identifying and addressing the even deeper root causes to chronic illness and symptoms. If you're interested in learning more about fatigue in general, Jacob Teitelbaum is a DO who wrote the book on fatigue back in around 1990, the first edition, called From Fatigue to Fantastic. And he's evolved over the past 30 years, just like all of us. And he is now in edition 4, which is very comprehensive. He is super sweet man who is also just very generous with his information, and his SHINE protocol, which is in the book, is a great outline, a great structure from which to start looking at fatigue. So you'll see a lot of the things we talked about in this book. So my goal is to help clinicians to help their patients. So the first thing that I am offering is something called the Exceptional Physician Intensive. It's open to physicians, nurse practitioners, anybody in the primary care world. It's a 12-week small group online live cohort intensive bi-monthly classes. The whole purpose is to learn about those 12 keys that I was just talking about, and to actually learn to be able to use them in practice. So it will include all of the practical things, like how to go deeper with labs, how to go deeper with nutraceuticals, and how to go deeper with our patients when we're time limited and we're energy limited and that kind of thing. We're going to be doing case studies, and also one-on-one sessions are additionally available. I'm hoping to create a community that we can continue to support each other. other. So anyway, if you have any interest in the Exceptional Physician Intensive, I'm about to show you the website. Just go ahead onto my website and you can look at that more. The other thing is that I created a total health reset program for clinicians to use in their offices with their patients. And it's an evidence-based, it's educational and experiential boot camp that takes your patient through that food allergy elimination protocol and gut repair and learning better ways to eat and learning about nutrition and taking the toxins out, decreasing inflammation, boosting nutrition, giving your body what it needs. And I find that in about 80% of people, that's what they need to turn around their fatigue and their brain fog and a lot of the imbalances in their bodies. The other 20%, is a deep dive from a functional medicine perspective. But the Total Health Reset program actually takes your patients, like who might be in the weeds with their health, and just elevates their health to a level where you can then really start to be able to see, okay, now we have to go here, now we have to go there, or they get what they need. They turn around their irritable bowel, or their pain goes away so they don't need that knee replacement, or their diabetes is now not diabetes anymore, their autoimmune issues go away. And these are the incredible things that I got to see working with about 600 patients over a 7-year period of time. So what I decided to do is to encapsulate it in a program and to offer it to other clinicians to use in their practices, because it was too much of a labor of love to just waste and not move forward with. So check out the Total Health Reset program. The next webinar series is going to be hormone balance and energy. So we're going to talk about the thyroid, the adrenals, and sex hormones and other hormones. I'm really excited about this because it also plays an enormous role in energy. And then the third one is going to be the surprising connection between gut and inflammation, immunity, infection, and fatigue. And then we're going to summarize the pearls. So hope you can join me for part 2 and part 3. Part 2 is June 17th, and part 3 is July 29th. I decided to do these monthly, and I'm going to continue the monthly series, I believe, because there's a lot of information to get out there. If you want more information, just go to functionalmedicineproject.org and you'll be able to see information on all those things I was talking about. You can always find me at Dr. Laura at impactfulmedicine.com. I'm sorry, Dr. Laura at impactfulmedicine.com. That's a typo on the screen. So it is a .com, or you can find me at Dr. Laura at functionalmedicineproject.org or through the website. But I'd love to have a conversation with you if something in here piqued your curiosity or you'd like to learn more, just have a chat. You can go to the website and also make an appointment for a chat so that we can get to know each other a little bit and see if maybe we might want to work together. Anyway, I want to thank you so much and for being here, for your attention. I hope that you were able to take something really useful or a few things useful from this talk. And I look forward to seeing you on for part 2. I look forward to seeing you for part 2 next time around. Thanks so much. I'm going to
Thank you, Dr. Laura.
You're welcome. I'm going to stop the share now, and I'll take questions also if anybody has any. I just want to thank you guys for coming on and supporting me in my first webinar. We're a small but mighty group, and hopefully it's going to build over time. So I really appreciate your being here, and I'm looking forward to the next ones. So I'm open to questions if anybody has. I will stop the recording though. I'm going to stop the recording.